A single invisible particle shut down borders, silenced cities, and exposed every crack in systems we thought were unshakable.
The event that brought the world to its knees. It didn't matter who you were, where you worked, what skin, faith, or belief systems you held. When our health was in question, we were all in it together. In late 2019, clusters of pneumonia of unknown cause were reported in Wuhan, Hubei province, China, with the earliest known cases dated to November and December. Chinese authorities notified the World Health Organization, WHO, on 31st December 2019 about this unusual outbreak, triggering international surveillance. By early January 2020, scientists had identified a novel coronavirus, later named Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2, genetically related to the virus that caused the 2002-2004 SARS outbreak. The associated disease was officially named Coronavirus Disease 2019, or COVID-19, and early reports described symptoms ranging from mild respiratory illness to severe pneumonia and death. Initial cases outside China appeared in early 2020, including in Thailand, Japan, South Korea, and later Europe and North America, often linked to travel from Wuhan or other affected areas. As case numbers climbed, Chinese authorities imposed unprecedented restrictions, including the lockdown of Wuhan and surrounding cities in January 2020, aiming to contain transmission. From outbreak to global pandemic. On the 30th of January 2020, the WHO declared the outbreak a public health emergency of international concern, its highest level of alert under international health regulations. At that time, confirmed cases had already spread across multiple regions, but many countries had not yet experienced large community transmission. By March 2020, COVID-19 cases and deaths had surged in Europe, Iran, and the United States, overwhelming hospitals in several cities and exposing the limits of preparedness. On 11th March 2020, with more than 118,000 cases in at least 114 countries and thousands of deaths, the WHO officially characterized COVID-19 as a pandemic. Governments responded with sweeping public health measures, border closures, stay-at-home orders, school shutdowns, restrictions on gatherings, and mask mandates, though timing and intensity varied widely. These interventions aimed to flatten the curve, to prevent health systems from collapsing under surging demand for intensive care, ventilators, and protective equipment. Think back to March 2020. What was the exact moment when you realized this was not just another news story, but a turning point in history? Share that moment in the comments, because those personal timelines together are the real global timeline of COVID-19. Clinicians quickly recognized that COVID-19 could progress from mild symptoms to severe respiratory failure, blood clots, and multi-organ complications, especially in older adults and people with underlying conditions. Intensive care units in cities such as Wuhan, Lombardy, New York, and others ran short of beds, oxygen, and personal protective equipment, forcing emergency triage strategies. Globally, by early 2023, cumulative confirmed cases had reached the hundreds of millions, and recorded deaths were in the millions, making COVID-19 one of the deadliest pandemics of the modern era. Excess mortality analyses suggest that the true death toll, including indirect deaths from overwhelmed systems and delayed care, was higher than the official count. Health workers, doctors, nurses, paramedics, lab technicians, cleaners, and caregivers faced prolonged high-risk exposure, burnout, and in many countries, significant mortality among their ranks. Hospitals postponed elective surgeries and routine procedures, while primary care and chronic disease management were disrupted, with long-term implications for cancer, cardiovascular disease, and mental health outcomes. The pandemic also accelerated changes in healthcare delivery, such as rapid expansion of telemedicine, remote monitoring, and digital health records, adopted under emergency conditions. Yet access to these innovations remained highly unequal, depending on infrastructure, regulation, and affordability across different countries and communities. Science, vaccines, and the race against time. Research institutions around the world rapidly sequenced the viral genome in January 2020 and shared it publicly, enabling diagnostic test development and vaccine design within weeks. Polymerase chain reaction, PCR tests became the gold standard for diagnosis, while antigen tests later offered faster, though sometimes less sensitive, screening. Global initiatives such as Operation Warp Speed in the United States and international collaborations under COVAX sought to accelerate vaccine development, manufacturing, and distribution. Several vaccines using different platforms, mRNA, viral vectors, and inactivated viruses, received emergency or full regulatory authorizations from late 2020 onward. From December 2020 through mid-2023, billions of vaccine doses were administered worldwide, significantly reducing severe disease, hospitalization, and death, especially among high-risk groups. However, vaccine access and uptake were highly uneven, with high-income countries initially securing the majority of doses while many low-income countries waited months or longer. Meanwhile, SARS-CoV-2 continued to evolve, producing variants of concern such as Alpha, Delta, and Omicron, which showed increased transmissibility and, in some cases, partial immune escape. These variants drove successive waves of infection, prompting booster campaigns, updated vaccine formulations, and renewed debates over restrictions. Was there a specific scientific breakthrough, like the first vaccines, rapid tests, or new treatments, that changed how safe you felt during the pandemic? Add your story in the comments, because those shifts in trust and fear are a vital part of this history. Economic shock and global markets. The pandemic triggered one of the sharpest global economic contractions in more than a century, affecting both advanced and developing economies. Lockdowns, travel bans, and distancing rules caused sudden drops in consumer demand, supply disruptions, and unprecedented shutdowns in sectors that rely on in-person interaction. International organizations estimated that the equivalent of hundreds of millions of full-time jobs were lost in 2020 alone when measured in total hours worked. Workers in informal sectors, women, young people, and low-wage service employees were among the hardest hit, often lacking savings, social protection, or the option to work remotely. Studies of major economies show that the pandemic shock reduced output across manufacturing, agriculture, services, and trade, though the depth and duration varied by region. Sectors such as aviation, tourism, hospitality, and entertainment experienced particularly steep revenue losses, while some digital and logistics businesses expanded rapidly. Governments and central banks responded with large-scale fiscal and monetary measures, emergency income support, business loans, expanded unemployment benefits, and historically low interest rates or asset purchases. These interventions cushioned some of the immediate damage, but also increased public debt burdens and contributed to later concerns about inflation and inequality. Across most industries, organizations were forced to modify work arrangements, with a rapid and uneven shift to remote work where feasible. Surveys show that telework increased dramatically in sectors such as education, finance, and professional services, while remaining rare in accommodation, food service, and many forms of manual labor. Governments mandated or encouraged temporary closures of many establishments, from theaters and sports venues to small shops, salons, and restaurants, with closure rates highest in arts, entertainment, and recreation. Some firms used government-backed loans or grants to continue paying employees or health insurance premiums during shutdowns, but many small businesses closed permanently. Economic analyses indicate that the pandemic widened many existing inequalities, both within and between countries. Those with digital skills, stable contracts, and the capacity to work from home were more likely to maintain income and health protection, while precarious workers and marginalized communities often faced higher exposure and fewer safety nets. Global supply chains also came under intense strain, as factory closures, port slowdowns, and transport disruptions created shortages of everything from medical supplies to semiconductors. These bottlenecks contributed to rising prices in food, energy, and manufactured goods, interacting with other shocks such as geopolitical conflicts to fuel a period of elevated inflation. Did COVID-19 change how you work, maybe permanently? Whether you lost a job, started working from your kitchen table, or shifted careers entirely, share how your work life transformed in the comments. These economic footprints are part of the pandemic's real archive. Education and the disruption of learning. School systems at all levels closed or moved online for varying durations, affecting hundreds of millions of students worldwide. In many countries, primary and secondary schools shifted to remote learning with digital platforms, while universities adopted online lectures, hybrid models, or temporary campus closures. However, access to devices, stable internet, and quiet study spaces varied drastically, leaving many students, especially in low-income households or rural areas, at risk of falling behind. International assessments and early research have documented learning losses, particularly in foundational skills, and warn of long-term impacts on earnings and social mobility. Parents, especially women, often took on additional caregiving and teaching responsibilities during school closures, influencing labor force participation and work hours. Children with disabilities or special educational needs faced specific challenges as in-person support services were suspended or reduced. Universities and research institutions also encountered funding constraints, interrupted fieldwork, and travel bans. But some areas of research, especially virology, epidemiology, data science, and vaccine development, expanded rapidly. Academic conferences moved online, changing patterns of collaboration and participation, sometimes lowering barriers for those previously constrained by travel costs. Social life, mental health, and culture. Beyond statistics, COVID-19 changed social rituals around birth, illness, and death, as hospitals restricted visitors and funerals were delayed, scaled down, or moved online. Many families could not be physically present with dying relatives, and grief processes were altered by distancing rules and border controls. Surveys and studies from multiple countries documented increases in reported anxiety, depression, and stress, particularly during periods of strict lockdown, job loss, or prolonged uncertainty. Young people, caregivers, and frontline workers were often identified as groups at heightened risk for mental health challenges. Cultural institutions such as museums, theaters, cinemas, and music venues closed or reduced capacity, prompting shifts to streaming, virtual tours, and online performances. Sports leagues postponed seasons, played in empty stadiums, or created bubbles, marking a visible disruption in global entertainment calendars. At the same time, communities organized mutual aid networks, food distribution, and neighborhood support initiatives, sometimes bridging social divisions. However, misinformation, conspiracy theories, and polarized debates over masks, vaccines, and mandates also intensified social and political tensions in many societies. From video calls replacing family gatherings to empty stadiums and silent streets, what social change during COVID-19 affected you the most? Share it in the comments and notice how many others lived a version of that same story. Global trade, development, and poverty. The pandemic significantly slowed global trade growth, particularly during 2020, as border controls and transport restrictions limited the movement of goods and people. Supply disruptions, combined with surges in demand for certain products such as medical equipment and home electronics, reshaped trade flows and logistics priorities. International financial institutions have reported that COVID-19 pushed tens of millions of people into or back into extreme poverty, reversing years of progress in some regions. Lower-income countries with limited fiscal space face difficult trade-offs between enforcing strict health measures and avoiding deeper economic hardship. Sectors like agriculture, fisheries, construction, textiles, and small-scale manufacturing suffered shocks from both supply-side constraints and reduced demand, particularly in export-dependent economies. Migrant workers and remittance-dependent households were especially vulnerable when travel restrictions and layoffs reduced cross-border employment. Aid flows, development projects, and humanitarian operations had to adapt to movement restrictions and health risks, sometimes slowing program delivery. Yet some global initiatives expanded, for example, to support vaccine access, emergency health financing, and social protection measures in lower-income countries. Environmental signals and unintended consequences. During the early phases of lockdowns, satellite and ground-based measurements recorded temporary declines in certain air pollutants in major cities as traffic and industrial activity slowed. These short-term improvements in air quality sparked discussions about how structural changes, rather than crises, might achieve more sustainable environmental gains. However, overall greenhouse gas emissions reductions were brief relative to long-term climate trends, and emissions rebounded as economic activity resumed. The pandemic also generated new environmental pressures, including increased use of single-use plastics from masks, gloves, and packaging, and surges in medical waste. International climate diplomacy was disrupted by travel restrictions and postponed meetings, but countries later resumed negotiations, including major climate conferences held under strict health protocols. Some governments framed recovery plans as opportunities for green investment, while others prioritized rapid economic restart over environmental conditions. Did the quieter skies, cleaner air, or empty roads around you during lockdown change how you think about the environment? Or did it all feel temporary? History will judge whether COVID-19 was a climate wake-up call or a missed chance. Policy, politics, and trust. COVID-19 became a major test of political leadership, state capacity, and public trust in institutions. Countries adopted different combinations of testing, tracing, masking, border controls, and vaccination strategies, and comparative analyses highlight wide variation in outcomes. Some governments implemented strict lockdowns and extensive testing early, managing to limit mortality and maintain partial economic activity. Others responded more slowly or inconsistently, experiencing large waves of infection and repeated cycles of imposition and relaxation of restrictions. The pandemic also intensified geopolitical competition, with narratives about the origins of the virus, vaccine diplomacy, and supply chain security becoming part of broader strategic rivalries. International cooperation occurred through mechanisms such as COVAX and scientific data sharing, but distribution inequities and export controls revealed persistent divisions. Domestically, protests and legal challenges emerged around mask mandates, business closures, school policies, and vaccination requirements. In some settings, COVID-19 measures were intertwined with broader political conflicts over civil liberties, populism, and institutional legitimacy. Transition from emergency to endemic. By 2021 and 2022, many countries had combined vaccination, natural infection-derived immunity, better treatments, and improved clinical protocols to reduce the risk of severe outcomes. Antiviral medications, monoclonal antibodies, and steroids became part of treatment guidelines, though availability differed markedly across regions. In May 2023, the WHO declared an end to COVID-19 status as a public health emergency of international concern, noting declines in deaths, hospitalizations, and intensive care admissions globally. Nonetheless, the virus continued to circulate widely, with recurrent waves and seasonal patterns in many countries. Experts have debated whether and when COVID-19 should be considered fully endemic, pointing out that the term describes a pattern of ongoing circulation rather than the disappearance of risk. For high-risk groups, including older adults and people with certain chronic conditions, COVID-19 remained a significant cause of illness and death, even after the formal end of the emergency phase. Health authorities in many countries incorporated COVID-19 vaccination into routine immunization schedules or seasonal campaigns, similar in some respects to influenza programs. Surveillance systems shifted from daily case counts to broader indicators such as hospitalizations, wastewater monitoring, and variant tracking. Today, some say the pandemic is over, while others still live with daily risk and loss. In your life, does COVID-19 feel like a closed chapter or an ongoing story? Share your perspective in the comments, because that disagreement is itself a key part of the historical record. lasting legacies and unanswered questions. Historically, pandemics have reshaped societies long after the immediate threat fades, and early evidence suggests COVID-19 is following that pattern. Changes to work, education, healthcare delivery, supply chains, and digital infrastructure are still unfolding and may influence productivity, inequality, and social norms for decades. Demographers and economists are tracking long-term effects on population health, life expectancy, and labor markets, including the impact of long COVID, which describes persistent symptoms after acute infection. The scale, duration, and social distribution of long-term health consequences remain active areas of research. Public health experts emphasize the need to learn from COVID-19 to improve preparedness for future outbreaks, including surveillance, stockpiles, institutional coordination, and communication strategies. Debates continue over how to balance rapid response with civil liberties, economic stability, and transparent governance in the next global health emergency. As future generations look back on COVID-19, they will read the numbers, but they will not feel the fear, the silence, or the small acts of solidarity unless we record them. What is the one lesson, memory, or warning you would want someone in 50 years to know about this pandemic? Add it to the comments below, and if this historical deep dive brought back important questions for you, consider sharing the video so more voices can be part of this living record.